Hello, my friends. Welcome back to the Diverse Thinking, Different Learning podcast. I'm your host, Dr. Karen Wilson. Today, we are going to expand on a discussion that we've had on the podcast previously about childhood anxiety, teen anxiety. And my guest today is Dr. Elizabeth Karp. Dr. Karp is a licensed clinical child psychologist and an adjunct lecturer at Stanford University in the School of Medicine. She provides evidence-based interventions, including cognitive behavioral therapy for children and families with concerns related to ADHD, anxiety, and autism spectrum disorder. She has particular expertise in working with parents to support their children in all of these areas of concern. I'm so glad that she's here to join us today. Please join me in welcoming Dr. Karp.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hi, Dr. Karp. Welcome.
Thank you so much, Dr. Wilson. It's great to be here.
I'm so glad that you're joining me today. Thank you so much for doing this and having this conversation with me.
Thank you for inviting me. I'm thrilled to be here.
So we are going to be talking about anxiety today, and we have discussed it on the podcast before, but I wanted to revisit it with you and even expand on previous discussions because it keeps coming up for so many children and adolescents. And, before we had Dr. Piacentini on the podcast from UCLA, and one of the things that he noted that still sticks with me is that 80% of kids with problematic anxiety are not receiving treatment. And that just seems like so surprising and disappointing because we know that there are effective treatments for childhood anxiety. And I'm thinking that it might be because parents may not recognize it or may not know there is cause for concern. As a clinical psychologist, are there signs or symptoms that parents should be attentive to that may indicate a need for professional support?
Yeah, I think it's a great question. And it is really the case that anxiety is incredibly common. We know how to help. We know how to provide effective treatments. And so much of it is just how do we get folks in the door? And so, when I talk with parents about what are they looking for? If they're wondering about anxiety in their child, or if they're wondering about whether it's time to seek help from a professional, I think there are, maybe three main questions that parents can ask themselves. So I think the first question is, how is your child's suspected anxiety? We can call it worry, nervousness, getting in the way of them living the life that they want to live. Right? So if they love playing soccer and they are no longer going to soccer practice, or they love playing their saxophone and they're not going to jazz band, they're just feeling too nervous, too apprehensive, those could be signs that it might be time to get some help from a professional. We also often see concerns like headaches, stomach aches, difficulty sleeping. And so I always recommend, let's rule out anything physical first, go to your pediatrician, get a checkup. And if there's no physical cause, one thing we might suspect or might wonder about is whether there's anxiety going on. So again, that first question, how is this worry getting in the way of your child living their everyday life? The second question is this a change for them? Right? Did they used to love going to soccer practice or going to jazz band, and now they're in a puddle of tears and they don't want to go anymore, or it's really, really challenging to get them out the door? Or, even on a more subtle level, are they holding back in social situations where they used to be really gregarious and outgoing and engaged? Those could be signs, that we might want to seek a consultation. And I should say that these changes can be gradual and kind of happen slowly over time, or they can be sudden. And both of those are a reason to potentially seek some help. And then the third question that I always encourage families to ask themselves is, how is their worry or anxiety impacting the entire family? Because child anxiety is very unique in many ways as compared to anxiety that appears in adults. And so, a child, just for example, may not be bothered that every day they open their lunchbox and a sandwich on a specific kind of bread with the crust cut off, cut at an exact angle, just appears there. They're happy. They're thrilled with that, right? However, the parent may be driving to an additional grocery store 20 minutes out of the way. They may have to wake up early in the morning to cut off the crust and cut it up just so in the middle and package it just right. And so, I often hear from families that, a child is not bothered that they have to call for their parents 10 times in the middle of the night because they can't sleep and their parent comes into their room. But of course, that's significantly impacting a parent's life or a family's life. And so that's just as good of a reason to seek a consultation, to seek a conversation with a provider, with a psychologist, or with a therapist.
Right. And I love those 3 points. And I'm thinking about that last point that you made, that parents might not consider the impact on the entire family. And I'm thinking about families who come in and say, we can't go on vacation, or parents say they can't have a date night because the child is too fearful of being left with even another family member or a babysitter. And it does impact everyone's life when those kinds of situations occur. So I'm really glad that you brought up those 3 areas where parents, or 3 questions rather, that parents can ask themselves. And, we talked about initially that it might be a reluctance to kind of seek out professional help because anxiety is so common. It might be one of those things where parents are thinking, well, everybody has anxiety. Everybody worries sometimes. But you really highlighted these 3 important questions that indicate that it might be moving from just normal worry to something more significant that is impacting a child's, daily life and a family's life. And there may even be some misconceptions about anxiety. Like, one of the things I said was that everybody gets nervous, everybody worries. Do you hear that come up with families that you work with as well? Because I think there are some misconceptions and myths surrounding childhood anxiety.
Yeah, absolutely. I hear that frequently, and it's true that everybody has moments of worry and everybody has moments of anxiety. And what I often talk with families about is there are helpful levels of stress or worry. I always say a certain amount of stress keeps us from running into oncoming traffic because we know something bad will happen. And that's healthy, that's adaptive. We want that stress to be there. It really is a question of, when does that anxiety tip into the point of no longer being helpful? When does it really get in the way? And how is it impacting both you and your child from living a full life? And so, I do often hear from parents when the anxiety is not so impairing, it's not getting in the way so much. And they wonder, should we come in now? Should we wait and see what happens? And I think that really depends on the family. I always encourage folks to take some time, and, there's no rush. We certainly, early intervention is always really helpful, and it has to be the right time. And it also has to be the right fit with the provider, which is another thing I talk about with families as well. And so, I encourage parents to talk to, if they're wondering if it's the right time to seek help, talk to the rest of the team that you already have assembled. Talk to your pediatrician, talk to your child's teachers, maybe even a school nurse, get to know, talk with the folks who know your child really well, and ask them their perspective. What do they see across different settings and scenarios?
Right. And I think the good thing about having a consultation, even if you're not going to move forward with, having your child work with a mental health professional, having that initial conversation, that initial consultation is helpful because sometimes a pediatrician who might have 10, 15 minutes with your child makes a referral and parents show up to your office or get on the call phone with you and they're not even sure why they've been referred. Yeah. Does that happen?
It does. Yeah, it does happen. I get calls from parents and they say, we're calling, we're not exactly sure why, we're not exactly sure what we're looking for, but we really trust our pediatrician and she made a referral. So here we are. And I love working with pediatricians, I should say. I really do because they know your family so well. They've known your family over a course of years. They know your child. They know your family's values. And so, that's okay. If you as a parent call in that moment, you don't have to have a particular diagnosis in mind. You don't have to have a name for anything. I think truly the most helpful thing that parents can do on that first call or during that first consultation is just describe your child. You are the expert in your child. You know your child very, very well. And so tell the provider that you're having a consultation with, what are the areas of concern that you have? And what are you looking for some help with?
Right. And again, that can be so clarifying for the parent because then they can kind of, as they're going through, describing their child with you, they're talking about all the things that are wonderful and great about their child. And then they also have the opportunity to share their concerns. And then together you can kind of walk them through, again, those three areas that you mentioned in terms of are the worries, are the concerns impacting their daily life? Is it keeping them from doing things that they enjoy? Are the behaviors, are the worries impacting the entire family? And then together you can make a decision on whether it makes sense to move forward with treatment for their child. And like you were saying, early intervention is so important because obviously we don't want the anxiety to get worse. We don't want, to have a child who has anxiety and then also becomes depressed because they're struggling with managing the anxiety. So again, that initial reach out can be really helpful and even providing parents with some information in terms of what they do.
Exactly.
And there's a lot of overlap between anxiety and depression. And I'm thinking that even during those conversations, a parent might be thinking that the worry is really the main issue, but then you might see that there may also be some depression there as well.
Mm-hmm. Mm-hmm. Yeah, it's very common. And there is a large overlap in the co-occurrence between anxiety and depression. And it does take some time to disentangle what is potentially primary, what's a primary concern, what's a secondary concern, and then to really develop a thoughtful and evidence-based treatment plan for moving forward.
Right. And it can be hard when parents aren't kind of experts in this area. They're experts on their child without a doubt, but they're not experts in kind of disentangling the anxiety and the depression. And I'm thinking about kids who may come in and who may already have a diagnosis, for example, like ADHD, or parents might be thinking about ADHD. There's still a lot of overlap with those symptoms. When we think about lack of focus, poor attention, difficulty kind of, staying with a task, getting started on tasks. Anxiety can prevent kids from getting started on tasks too. If they're a perfectionist and they're worried about writing the wrong thing, saying the wrong thing, they may not participate in class because of anxiety, not because of a language disorder. And so there's so many nuances that can manifest in kiddos. So it's really important to have someone who can really understand those nuances so that your child is getting the support that they need in the areas where they need support.
Absolutely. And I always say to parents, it's not your job. You are not the diagnostician.
Right.
You are the parent. And so all of those complexities that you were just mentioning, that's where somebody like a psychologist or a neuropsychologist or a therapist comes in. And that's our job to really help and to partner with families in order to understand these different areas and how they're showing up.
Right. And when we know that it is anxiety, it's been confirmed by, a mental health professional. We know also that there are long wait lists for mental health services, and that's becoming increasingly common. Are there strategies or activities that parents can implement at home to help address their child's anxiety? Obviously, they're not trained as mental health professionals, but there are things that they can do to support their child, correct?
Absolutely. Absolutely. And there just are such long wait lists. I mean,
Yes.
it's just, we have such a relative lack of providers for all of the need that's out there. And so it always is, it's always heartbreaking to hear from families how long they've been waiting and, what they've been looking for. So I just want to say, I hate that there are so many wait lists, and I hate that parents are running into this. I really think the first thing for parents to know is that you're not alone. You mentioned this earlier, that childhood anxiety is incredibly common, and it's also incredibly treatable, right? We know that strategies and therapies like cognitive behavioral therapy are effective. So I think that's just the first thing to keep in mind and to remember as you're on this journey or going through this process. And I think the second thing, and this may sound simple, and the simplest things are not always the easiest things to do at times, or it's easy to forget sometimes that, it's really important to just let your teen know that you are there for them. You're there to help. Telling them that it's okay that they may not know why they're feeling anxious or why they're feeling worried. I think that a third thing that parents can do in the meantime is start to think about ways, if it's possible, to have your child engaged in what we call mastery building experiences. So these are experiences or activities where a child sees themselves developing a skill set and progressing and getting better at something. So this really taps into all of the growth mindset research that we know from Carol Dweck's group, right? And it's really this idea that you don't have to be good at an activity off the bat. It's really what's really powerful in developing self-esteem is seeing ourselves making progress, seeing ourselves getting better. So if a child is interested in rock climbing, for example, they may have never done this before, but rock climbing is a really good example. Over time, you can see yourself climbing higher and higher and doing harder and harder courses and things like that. So just finding some sort of an example of an activity for them where they can really engage, they can see themselves building a skill set, and they can see themselves building some mastery around it.
Absolutely. And can you talk about why that's important? Because I can see the kiddos who, are afraid of making mistakes or afraid of getting things wrong, how that would be so helpful for them to see that something can be hard and that over time they can get better and that would alleviate some of the anxiety.
I think it's hugely important. I mean, it's hugely important for all of us, right? To see that perfection is not the goal, and perfection, quite frankly, is usually not even achievable in most aspects of our lives. And so I think for kids who are experiencing anxiety, experiencing difficulty making mistakes, it really is teaching them that, first of all, probably you will make mistakes, right? At least some percentage of the time. And second, that's okay, that mistakes are not dangerous, right? That mistakes are things that we can overcome and that we can see, okay, yesterday I couldn't climb that particular course. I only got, a quarter of the way through. And maybe after a couple of days of that same rock climbing course, maybe I'm able to get halfway up and oh my gosh, it's visual, right? It's observable, it's demonstrable that I am actually making improvements. I'm getting better. It's building some of that resiliency. And, particularly from an anxiety perspective, a lot of treatment, and I know other folks on the podcast have talked about this, but a lot of treatment for childhood anxiety focuses on what we call exposure therapy, which is facing our fears, doing the thing that scares us, that our brain is telling us is dangerous, but it's not actually dangerous, but our false alarms are going, right? And so for a child with anxiety, something like trying a new activity, seeing that they can make mistakes and still make progress really could be an example of kind of a building block of exposure and something that they'll talk about later in treatment with a provider once they find the right fit.
Right. You've also, when we've had discussions, before even this podcast conversation, you've mentioned the SPACE program as a valuable resource for parents supporting children with anxiety. Can you talk a little bit about that program?
Yeah, absolutely. So the SPACE program, it stands for Supportive Parenting for Anxious Childhood Emotions, was developed out of Yale University. Dr. Ellie Leibowitz is the developer of the intervention. And it's an incredible program. It's evidence-based. And what we know is that what the research shows, which is very exciting, is that it's actually just as effective as individual cognitive behavioral therapy with children. And so the SPACE program is really focused on helping parents learn how to help their child. And so if a child with anxiety is not in a place where they can engage in treatment, or they want to engage in treatment, quite frankly, we have SPACE as an excellent option for parents to engage themselves. And so, I think one of the things that's very striking to me about the SPACE program is that Dr. Leibowitz talks very specifically about the fact that childhood anxiety really is very unique. It is unique from adult anxiety in the sense that there is a biological pull that parents experience to help their children, right? It is a parent's job to keep their child safe, to keep their child alive, to keep their child well. And what happens when we have a child who's experiencing anxiety is that pull for safety happens much more often than it would for a child without anxiety. And it also happens when there isn't actual danger present, right? It's not actually dangerous to eat a sandwich on any old type of bread with the crust on or off. It's not actually dangerous to go to jazz band, right? However, for a child with anxiety, these things do feel very dangerous, right? And so parents are pulled into that protector mode, into that savior mode much more often. And so the SPACE program has a series of steps. It's very digestible, and it's very clear, which is something that I really appreciate. And I maybe I can even describe one of the strategies, one of the initial strategies.
That would be really great.
So this is one of the first strategies that I work on with parents when I'm doing SPACE with them. And the name of the strategy is supportive statements, right? Dr. Leibowitz also affectionately refers to these as mac and cheese statements because there are only two ingredients, right? You've got your mac and you've got your cheese, and that's how you make a supportive statement. So the mac in this equation is acceptance, which is saying to a child, I can see that you're feeling really nervous right now. I can see how anxious you are. I can see how worried you are. I can tell that you're feeling really scared right now, right? Immediately starting with, I see you, I'm here, and giving a name to that emotion as well that the child is experiencing. So that's our MAC is our acceptance, and our cheese is confidence. And what we mean here is, and I am confident that you can get through this moment. I am confident that you will be able to ride this wave, that you can manage that feeling, and that we really need both. We really need both the acceptance and the confidence piece in order for children to kind of get that messaging and internalize that messaging, that it's okay to feel how I'm feeling and I can get through this moment. This moment isn't actually dangerous, even though all of my alarm bells are going off.
Right, right. And there may even be a pull for some parents to, when they see their kid is worried about something that is clearly not a danger to them, to say, you shouldn't be worried about that. Don't worry about that. But what you are saying is that they really need to validate that child's fear by accepting that they are feeling the way they are, but then also letting them know, again, that confidence piece, that you have confidence in their ability to work through it.
Exactly. Exactly. It really is both. Because I think when we jump right to the confidence piece, we don't give a lot of space for our child
Mhm.
to feel seen, feel heard, even just have a name for what it is that they're experiencing, right? We really do need both. And I think sometimes there can be a worry that I hear of, well, if I name it, am I saying that they should feel
Mhm.
anxious, that it makes sense to feel anxious in this situation? Because it may not match the facts of the situation. And so what I always encourage is, let's meet your child where they're at. Let's validate their feeling. Let's give a name for it. And let's also tell them that feeling is not dangerous. It's really both.
And it seems like these principles, these activities can be integrated into the child's daily life for different things that they're fearful of, whether that's going to a birthday party or going to school on Monday morning. And, again, you talked about the bread, and there's some kids need that sameness. And sometimes things happen where we can't do things this way today. And again, they can use this principle of acceptance and confidence in those situations, in a number of different situations.
Exactly. It's a very portable strategy, which is
Yes.
one of the reasons that I really like it. And I will say that I find all of the strategies taught in space to be very portable and to be very applicable across a variety of situations that come up for families.
Right. And I know that so many families struggle with striking that balance between providing support and encouragement for their anxious child while also fostering independence and resilience. And it feels like the example that you gave allows them to do both, provide that support, that acknowledgement, that acceptance, and then also the confidence piece helps to foster that independence, because we don't want them to be avoiding situations. We want them to be able to try, like you were saying, develop that mastery in situations that make them anxious.
Exactly. And anxiety tells us avoid, 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 get out of there. It's dangerous. And so the more a child has experiences of approach and doing the things that scare them, facing their fears, the more we see some of that confidence increase, that self-esteem increase, and that anxiety hopefully reduce as well.
And it seems that, we talked about the long wait lists, and I think that's coupled with the fact that we're still in the midst of a youth mental health crisis. And there's a great need for support for kids who struggle with anxiety or struggle with depression, other mental health challenges. And it seems that even when parents get in with a psychologist and their child is working with a psychologist, the SPACE program would be helpful for them as well. It sounds like getting them in is not just the be all and end all, because you're not just closing the door with the child in the room with the therapist and then parents don't have to do anything else. Parental involvement is key part of a child's treatment for anxiety.
Absolutely. It really is. And, parental involvement can look a lot of different ways in treatment. It might be, something like parents participating in the SPACE program, learning those strategies. Or it might mean that your child has, the space with their therapist, with their clinician. And what I always recommend is in those cases, make sure you're in regular contact with the provider. Make sure that you know what's being taught in session so that you're able to encourage the practice of those skills between sessions. And I think, what we know from the research in cognitive behavioral therapy is that one of the most effective components really is the practice in between sessions, right? It's really the, doing the exposure practices on a daily basis. That's where we see a lot of change. And so the more involved parents or caregivers are in helping a child to do those exposures, the more it really becomes a family value, is what I've seen. Of we as a family face our fears and we all have the skills, we all have this toolbox built up together so that we are in this together. We can approach these situations together. And I just think it's such a lovely moment when that happens. And I kind of call it living the exposure lifestyle, right?
Right.
that we do the things that make us feel anxiety, and we do the things that make us feel worried, so that we can see that we can do it, that we can cope with it.
Right. And it also sends the message to the child who we may be most concerned about that, we all experience some levels of anxiety in our lives. And there are things that we can all do to make those experiences better. And as a parent, you can say, these are things that make me nervous, that I worry about. And those strategies that, your therapist was talking about, I actually use that today when I was nervous about giving a presentation, when I was nervous about, asking for, a particular, thing that I needed from a neighbor or from a family member.
Absolutely. I think there's this urge sometimes. I talk often with parents about the coping versus competency model. And I think there can sometimes be this urge to say, I never feel nervous. I'm your parent. I've got it all under control. And what we actually know is that it's more effective and more helpful to present a coping model, which is exactly what you just described of, sometimes I feel nervous and here's what I do to help myself. And that can be so powerful for children to hear.
Absolutely. And checking in with them to see if things have helped. I took some deep breaths. Do you want to take some deep breaths right now? How do you feel now? So doing that check-in to see if it has worked. And when you have a number of tools in your toolbox, because you've got strategies that have been shown to you by professionals like yourself or through the SPACE program, if one is not working, you can pull another tool out of your toolbox and see if that works. It may be a walk outside.
Mm-hmm. Oh, absolutely. Absolutely. And I think that's, again, where it becomes so critical that you as the parent know what that toolbox looks like, what your child has been developing in therapy with their clinician.
Right. Dr. Karp, thank you so much for sharing your insights, your expertise with us today. It's just always so important to be able to share, again, this information with parents who are worried about their kids, who want to make the best decisions they can for their kids and their families. If families want to get in touch with you to learn more about how to support their child's anxiety, depression, or other social emotional challenges, what is the best way for them to connect with you?
Yeah, so the best way for families to find me is to go to my website, which has all of my contact information and also a link to sign up for a consultation phone call, which is www.elizabethkarpphd.com.
Perfect. And I'll be sure to put that link in the show notes. Thank you again for being here. It's always such a pleasure to talk with you.
Thank you so much, Dr. Wilson. It was really, really a pleasure.
Thank you so much for joining me today. Special thanks to our guest, Dr. Elizabeth Karp. Be sure to check out the show notes to get in contact with her to learn more about the SPACE program. And if you've got a child or a teen who's struggling with anxiety and you want to know more about anxiety, do a deeper dive, and know how to support them, consider enrolling in our self-paced mini courses. You can get that information at childnexus.com and click on the link that says mini courses. Thanks again for listening, and I'll see you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.